I'm with Yazan Al-Zubaidy from Red Noses International. Now, Yazan, what is Red Noses?
Red Noses is an international NGO that is working with sick kids in hospitals. Mainly, it's that we bring joy and laughter for sick and needy people. Our main working area is Clown Doctor, where we are more like working as clowns and doctors, as the name says. And we try to bring some joy and laughter for the sick people, sick kids actually in hospitals.
And when were you founded here in Palestine?
Officially, we are founded as branch. In last year, it was 2012, and was the official registration of the organization as a branch of Red Noses International.
And what sort of projects do you run?
Now mainly we are concerned about the Clown Doctor project. We have also a project is called Emergency Smile, where we go to affected areas by floods or war or whatever, and we go and do some activities there for the children to at least relieve them from the stress that they're having and the trauma that they might have. For example, our artistic director last month, he went with a team from Red Noses International to Syrian refugee camps in Jordan. So based on that, we would like to more work with refugees, but mainly our main project is the Clown Doctors. And we have also the Emergency Smile, but it's also part of the Red Noses International.
Obviously, there's a lot of Syrian refugees in Jordan at the moment, isn't there?
Yeah. And we try to do some work with them, aside from politics and religion.
Yeah. And how many people do you have on the team here in Bethlehem?
First of all, the team is not only in Bethlehem; it's spread in the West Bank. We have we have clowns from Jerusalem, we have clowns from Ramallah, we have clowns from Jenin even, and we are in the team. We have 12 clowns, and we have an artistic director, and we have the program director, which is me, and so we work like we have different. But the most important thing is that all of the staff are youth. So we are working now to empower. It's part of the work that we work with youth. We try to give them a way to provide themselves and like have some money to actually work, because we have a very high rate of unemployment. So it's part of supporting them. Also, it's part of our work to support youth in a different way, for sure.
Yeah. So this isn't voluntary work, this is paid work.
Yes, it is paid work. We pay the clowns. It depends on the years that they spent in the organization. The old clowns get a little bit more than the new clowns, and so on. Why we pay them, as I told you, because we think that we need, like, Palestinian youth need opportunity to work as freelance, for sure. They are not full-timers. Also, because we need to sustain the very high quality we provide, because we are working mainly in hospitals, and in hospitals it's very critical situation, because the kids, like, they have like diseases like cancer, and so there is a special way to work with them, and this way is just to have very high quality, very good hygiene, and all this related things that is related to the high standards that we give as Red Noses.
And how welcomed are you in the hospitals?
We are actually very welcomed from in the hospitals. Like the administration in the hospitals like us very much. They love our work. The parents of the kids, they always laughing when our clown doctor team are there. And the most important thing are the kids, that they wait us from week to week. Sometimes some kids, they would like to have their chemotherapy in the days that we are in the hospitals. it's just amazing how people react towards this idea.
Are the clowns well trained before they go into a hospital situation dealing with people who may be terminally ill?
Yes, they are well trained. We give them workshops continuously. The professional clowns and trainers from Vienna, Austria, where is our headquarters. They come to Palestine. They give our clowns workshops to deal with sick people, also to artistically be more creative, and all this training is continuous training. Also, in choosing clowns, we are very picky. When choosing clowns, we make auditions and so on. So it's not an easy process. It's a very long process, but it's very also strict process, because we would like to have the best.
So it's a little bit like Clowns Got Talent in some ways, is it?
I wouldn't call it this way, but it's the same process, yeah.
Are there any health benefits to the humor that you provide for the kids?
Yes, for sure. Mainly we are working on the psychological part of sickness. And laughter proved that laugh is one of the best medicine that people need. Amazingly, sometimes when you see sick kids, for example, if they are taking their chemotherapy, it's not something nice, it's something painful. It's something that take the energy out of the kid. So when we go, sometimes we see incidents like the kids were crying, they don't want to take the medicine, and then when our clowns just go in the room, they start to laugh. And then they take their medicine, or they eat. They don't want to eat, and then when our clowns are there, they eat. So the human part of doing this thing is beyond expectation. Kids react in a very good way. The benefits are. I don't want to say that it cures them, because physically it can't, but at least emotionally there are benefits, and we can see these benefits. At least when you see a smile on a child face, it's like an amazing things to see in hospitals.
And the doctors are seeing benefits as well, are they?
Yeah, sure. Yeah. And the doctors see the benefits, and the nurses, mainly the people who are around us are nurses. So yes, they see the benefits, and they wait also for us to come and help. And sometimes the doctors and nurses start to play with our clowns, and so yeah.
Yeah, that's good fun. Yeah. And when you go into a hospital, is every child different, and do they all have different needs?
Yes, we work with kids or a child. Depends on their cases, because our work is not based as a show. It's more personal interaction with the kids. So it depends. If the kids needs something, we do something. It depends on the case. We can't say this is what we do. It's more like this is the character of the clowns. They go in with every child. They give each child his or her own time. They make them laugh. They make them play with them, and then they move to another a child. So it's kind of bed to bed working, every case by case.
And how many hospitals do you go in? And which hospitals do you go into?
Okay. For now, we are going into 4 hospitals: Hebron Hospital, Alia Governmental Hospital, Beit Jala Al Hussein Hospital in Bethlehem area, Jerusalem, Augusta Victoria Hospital, and in Ramallah, the Palestinian Medical Complex, PMC in Ramallah. These are the hospitals that we are visiting right now, with total around 100 kids per month. But we have near future plans to expand to the north, especially Nablus and Jenin. But it also depends on the funds. So we are trying to expand to other areas. Also, we want to expand also our activities to include more visits to the hospitals. So it's in the near future plan.
So are you also able to get into Gaza at all at the moment?
At the moment, no, but we would like to go to Gaza. Lots of people are sending us messages or emails, and they want us to be in Gaza, but we can't promise anything. Like, we have to wait and see the arrangements, what we can do, and I hope one day we will be there.
And why do you do what you do?
Why? Because it feels that this is the right thing to do. Like, having a smile is one of the most important things, and kids are not supposed to suffer, and people are not supposed to suffer. Like, we are all humans, and everybody should laugh, and it just feels right to do it. It just feels right, and yeah, as I told you before, like, our vision is to bring joy and laughter for sick and suffering people.
So what's your prayer for sick kids?
Our prayer is to make them smile, to make them laugh, to make them feel less pain. And as I said before, it's like we bring joy and laughter to sick and suffering people. And this is what we focus on. Yeah, that's the main thing that we're focusing on.
And what's your website for people who'd like to know more?
It is www.rednoses.ps, and we are on all the social media as well, so you can follow us.
Okay, Yazan, thank you very much.
Thank you very much for this.